The golden rule is don't change your chronic medication on race day. If you're on any chronic meds, whether it's for asthma, epilepsy, blood pressure control, or even heart medication, please don't alter it or change it just for the race, and don't forget to take it on race day. You're used to training within the parameters of your blood pressure being controlled and all the other body mechanisms. And then of course there's medications that you need to be cautious of. One of the crucial groups that you need to have knowledge about in terms of medication are painkillers. So analgesics comprise different categories of drugs. A simple example would be the NSAIDs, the non-steroidal anti-inflammatories that you often use for muscle aches and pains. And some people, even with sporting events, take them prophylactically because they haven't trained and they're weekend warriors. They think, I'm going to take it before the race so that it protects me from tomorrow's body pain. And that's where you put yourself at risk. There's a strong association with anti-inflammatories in endurance events and kidney failure. And a lot of people don't know that it can affect your kidneys adversely, firstly by a direct effect on the kidney tissue, causing damage to the filtering cells of the kidney. And secondly, it can also decrease the blood supply to the kidney, which also puts you at risk of kidney failure. Other categories of painkillers involve things like simple antipyretics, things like paracetamol. Very important to know that combining certain medications with alcohol can induce liver toxicity. Specifically, 4 paracetamol tablets combined with the wrong amount of beer the night before could injure your liver. But even more importantly are the more serious painkillers, things like the opiates. And by that I'm not only speaking about morphine and tramahexyls, I'm speaking about drugs that contain codeine. And they affect your level of consciousness, which could affect your concentration on the bike. And as you're coming around Hospital Bend, you might just miss that one clue that you need to reduce speed or alter something in your course, which could lead to dire consequences. So don't take medication that affects your level of consciousness. Other meds include your EpiPens, for example, or people that are known with anaphylaxis often forget to bring along, obviously, the EpiPen, which is an adrenaline pen essentially that you need to take in the event of you being at risk of developing anaphylaxis, which could kill you. Often something that's overlooked are people that suffer from allergies. You might forget that we've got the most spectacular fynbos in the world right here, and you might think, why do I need my EpiPen? I'm not going to be eating sesame seeds or nuts. I know what I've packed into my bag, but bees are everywhere around the peninsula, and at any time you could actually ride through a swarm of bees, which could save your life.